Okay, wonderful. I have you both checked in. N5RTF and N3AM. Chip, it sounds like your audio though might be somewhat muffled. You might want to check that AA for us.
I'm on Yasu again, so that may be the problem.
No, you sounded fine on that last transmission chip. I don't know what was the first time, but sounded good there. Any other? Oh, we don't need to do early check-ins now because guess what, guys? It's the top of the hour. So it's AA4L for the McClellan's Radio Council TV Net. Today, I am operating out of Hawthorne, Florida, north central Florida, Echo Lima 89 grid square, about 15 miles east of Gainesville, and maybe 17 miles east of the University of Florida. I'm glad to be here with everyone today for the DVNet. We've had 4 early check-ins, AA4FL, my stuff, BY2BBQ, N5RTF, and N3IM. I'm sure we'll have a few others joining the group here. This is a directed net, good through net control and fast. If anyone has any emergency traffic to start the next day before we do housekeeping, anything that's emergency priority, go ahead and make it.
AA4FL, this is K3FZT.
Good morning, Steve. K3FZT AA4FL. For those of you listening and haven't checked in yet, as you noticed this is a directed net, and here on the QuadNet array, we have to honor and respect the technology, make sure not to tailgate the person in front of you because you don't want to lose out on syncing all these different repeaters and hotspots. However, anyone is getting on here for the digital modalities, all these different modes that are being transcoded. And you might want to pause 3 to 5 seconds after you do key up before you speak for the same reason to make sure we get maximal efficiency of the technology. Are there any other stations here, any stations that are here on a limited basis, mobile, or just can't be here all the throughout the net? Let me know and I'll make sure you're acknowledged first on the roundabout sessions. Go ahead and make your call to AA4L.
AA4FL, this is K3FZT Mobile at the Philadelphia Folk Festival. In and out.
Oh, very nice, Steve. K3FCT, glad you're getting out and about for something enjoyable. Would you like to make a report or contribute to some of the discussion threads from last week before we start our regular check-ins? Since you're in and out, go ahead.
I'm on Android Blue DB back to the Ambi server at my house. I, in terms of further commentary about last week, I have nothing to offer here, and I need to drive and not talk. So I'm going to say 73 to everyone and be clear after this transmission. C3FZT mobile is clear.
QSL, Steve, enjoy the folk festival there in Philly. Have a wonderful day and wonderful weekend. 7-3. Any other stations for regular check-in? Anyone that would like to check into that? You don't have to be a Marco member. If you're monitoring and you would like to listen, that's fine, but let us know you're there so we can help. It will help us what we discuss in the discussion threads and what depths we go into using medical terms versus layman terms. So any other stations to check in, make your call now.
N4TSC, if you can hear me, and I'll let you know about what I discovered yesterday. AA4FL N4TSC.
N4TSC, you know, you're perfect on that. No problem at all. Your transmission was just great, Jerry. Glad to have you on board here for the net here today. Any other check-ins? Direct your call to AA4FL. Well, no other check-ins heard at this time. So, a little feedback from Hawthorne. I'm getting ready for a road trip tomorrow. I think I mentioned it last week. I have to spend 3 days on the West Coast in the Tampa area. I made a presentation about 50 miles from Tampa on Thursday night to a radio club of the 33A expedition. But this particular trip is going to start with a visit to Warren Brown's house. So I'll be there for the ground rounds. Randy, my wife, is coming with me. We're going to get lots of photographs and honor him in ether. You'll see him in action during the ground rounds on his microphone. And also get pictures of him and his artwork. And I've got some archives. Let me let it drop one and I'll talk to you about that. Warren will be giving me a copy of all the ethers back to 2000. He already went back to one in 2006 that he did on polio and cut out the article for me. I will put his article on polio there. We've asked a few others to write some articles about polio, the current status, the current resurgence, where it stands. And of course, a lot may change between now and the time we finalize the ether in mid to late September. But Warren will be a key feature of this edition, as well as our ARRL scholarship winner, with her and her family. All three are hymns, and one father's Marco member. So those will all be featured in the ether as well. I'm going to go ahead and turn it over to Hilton for his comments. PY2 BBQ. Go ahead.
Okay, A4FL and the group, this is PY2 BBQ Hilton from São Paulo. Nice to be with you today again this weekend. Well, we are approaching the ending of the winter time here in São Paulo, and it seems that we had the last cold wave from the South Pole that arrived here yesterday, and the temperatures here in the south of the country dropped to here in São Paulo. We reached 48 degrees Fahrenheit, which is pretty cold for our standards. In the south of the country, we had freezing temperatures and even snow in some places. But it seems to be the last of the year. And regarding other stuff like COVID-19, things are pretty stable. We don't need to use masks anymore in the airplanes or airports, but only in healthcare facilities. It's still mandatory. And regarding monkeypox, we reached about 2,000 cases in Brazil, most of them in São Paulo state and São Paulo city. And the interesting thing is that this disease is behaving like a sexually transmitted disease in most of the cases with no severity. So that's the story, Jay. Back to you, A4FL, PY2BBQ.
Well, thank you, Hilton. This is AA4FL, PY2BBQ, and the rest of the Marco Digital Voice here this morning. I'd be interested to see the description of sexually transmitted disease features if it's limited to a certain segment of the population, like HIV was, or if we're talking about all across uniformly. But again, a lot will be written, I'm sure, in the upcoming weeks and months about the disease. Any further comments, Hilton? Go ahead, PY2BBQ.
Yes, yes, indeed. That's an interesting pattern, not expected because it is transmitted by skin contact, not exactly sexually intercourse, but that's what is being seen here in Brazil, especially. And there's another interesting subject that we were debating last week regarding polio vaccination. And the polio vaccination annually campaign started here in Brazil, and it seems that only about 60% of the children population received polio, the annually Sabin vaccine was given only to 60% of the population, target population. In the last 2 years, we used it to have more than 90% of the children annually vaccinated with the Sabin vaccine. So that's something to be concerned about. So back to you, JA4FL, BY2BBQ.
PY2BBQ, AA4FL, the Barca Medical Image Radio DV Group. Well, with polio, of course, if you had lived through it like Warren did, who had polio and ended up in the hospital, not with a bad case, but seeing all the individuals that were in iron lungs. And if you grew up in that generation when the vaccine became available, you probably were very receptive to getting it. I doubt there was many abstentions, but nowadays, who knows? So as you said, a lot of people aren't vaccinated. So the question remains to be seen if it starts to become more prevalent, and if it does, and the morbidity is as severe as it was back then, will that be an incentive or an encouragement for people to get vaccinated if cases with terrible outcomes are publicized? So a lot's going to be said over the next few years if it takes a toehold. If not, and the cases are limited to that one area, and there's limited areas and decrease, then it won't be an issue. But I guess with let me let it drop one. AA4FL, the Medical Image Radio Council TV net. But with the morbidity and mortality associated with COVID-19, obviously there were still many individuals that were reluctant to the vaccine. Now, granted, it was because for some individuals didn't feel comfortable taking an RNA, R, RNA type virus the first time, an mRNA, that it was developed. But we'll have to see how that translates as we have more. I mean, vaccines, not viruses. We'll have to see if we have more vaccines of the mRNA variety and whether or not that same reluctance exists in the future, since they tend to be the most adaptable to be quickly developed. And we anticipate there will be future diseases based on that technology. So we'll open it up. Hilton, let me let you make comments about that before we move down the list. PY2, BBQ, AA4,
Okay. A4FL, PY2, BBQ returning. Yes, I would say that the problem, if you have a few cases of polio in a area, you can be sure that you have at least 100 more people infected with polio, because only 1% will have clinical symptoms. That's really a problem. The real advantage of the polio vaccine, the Sabin vaccine, is that it's given the vaccinia virus, which produces an infection that will have a cross immunity with the poliomyelitis virus. So, what we need to do is short campaigns and very comprehensive campaigns to vaccinate at the same time most of the child population, because if you do so, you will create an epidemic of the vaccinia infection. So even those children that were not vaccinated, they may be immunized by the vaccinated kids. So it's not as easy. The best way to go is to do very comprehensive campaigns and vaccinate at the same time as much children as possible. So that's what we use it to have here annually, with more than 90% of the children being vaccinated, and that dropped to less than 60%. Wait one. And of course, regarding the morbidity in COVID-19, it decreased a lot. We still have cases as an endemic disease, but the mortality and the morbidity decreased a lot. So, in my opinion, at least here, we should declare the pandemic ended, the end of the pandemic and the beginning of the endemic state for COVID-19, and finally be back to normal life. Okay, so back to you, JA4FL PY2BBQ.
AA4FL. Please excuse my ignorance on the subject of not knowing that it was the live vaccine or a vaccine that encouraged spread to other people that were not vaccinated, which in the United States, if it was discovered today, probably would not be acceptable. Unfortunately, for litigious reasons, there was a professor I worked with at the university, oral biologist, who developed a strain of strep mutans that causes dental decay that had advantages. He was genetically modified. It would not produce acid when exposed to sugar. It would have eliminated dental decay. But the problem was is that it would be spread through the population even if you had not had that introduced in your body. And that set up a litigious situation that, maybe if it was a life-threatening disease, parents wouldn't care, but a lot of them during this anti-genetic engineering phase would have been in favor of their children being exposed to something without their permission that only eliminated dental decay. Was not a death-saving, mortality-saving event. I mean, just food for thought as we go on and have the discussion thread. That being said, Chip N5RTF, and turn the mic over to you. This is AA4SL. Okay, I did not hear Chip. We'll come back to him later. I know that Andy is now checked in. He's here online, WJAB, so I've added you to the list, Andy. But M3IM, Keith, go ahead.
AA4FL in the group, this is M3IM. Your thing about the dental decay brought back to mind years ago when Texas tried to mandate the HPV vaccination for children under a certain age, and that became a litigious situation because parents were up in arms about it. Now today, it seems that HPV vaccine is more acceptable. Great question. As far as polio goes, probably this individual will fit into one of three high-risk groups of traveling to a country where the risk of getting it greater. Like the first case was noted in England, so maybe they were in England, or in English case, they may have traveled to some country where it was prevalent. Great one. As far as monkeypox is concerned, the CDC is not considering it a sexually transmitted disease because it can be transmitted by fomites as well as direct contact. However, they are making it a point to be aware of the fact that sexual contacts, kissing and hugging and having sex is a potential way to get it. However, fomites can also do it. And we have like 15,000, almost 15,000 cases of monkeypox in the United States. Great one. I believe it's Omicron BA5 is accounting for about 90% of the COVID infections at this point in time in the United States. And we're in a county with a medium level of COVID-19 cases, mostly mildly symptomatic. Center County, or Lycoming County, currently is undergoing the Little League World Series, so we'll see what happens in that county in the near future. And I posted a thing on long COVID symptoms on the Marco website, Facebook rather, and that's got some interesting information. So this is N3IM, back to AA4FL in the group.
Thank you for the explanation, Keith. N3IM, AA4FL. Thank you for elaborating on that. Chip, are you back? N5RTF, go ahead. Okay, well, we'll come back to Chip later. And K3FZT was with us earlier, Stephen, and he said 7-3. He was here for short-term check-in. And for TSC, Jerry. Good morning. Go ahead.
Okay, thank you, Jay. This is N4TSC, and hopefully I will continue to be heard. Got a few random remarks to make. The first is that I participated in a net, the Francophone net yesterday with 40 participants, and the net controller, F5FHD, responded when I told him about the issues I was having with the MD380. He said he had the same kinds of issues, and he discovered that if he cleaned the contacts on the batteries, it made a difference. And so I just want to report that I was testing that out this morning to see whether I could hear Hilton. Unfortunately, the cycling of the on and off of the radio continues from Hilton unless I turn the volume down to 0, and then I can't hear him. But in between his transmission and the radio that's causing the problem. But for the moment, it seems that cleaning the contacts made a difference. Now let me make some comments about some anecdotal things about polio. Wait one. I'm a little older than most of you guys, so I remember at the time that I was 8 or 9 years old, we used to go to a beach resort called Down the Shore, which was Belmar, New Jersey. And I remember one summer and a following summer, we were not permitted to go to Asbury Park, which was only 3 miles away because of an outbreak of polio. Then we moved to a few years later when the killed virus developed by Dr. Salk became available. And I remember the advice that the internist to my family had, which was he would advise not to get the vaccine because it was not certain what the results would be, and therefore he advised to wait and allow others to have the vaccine, and thereby we would, if it was effective, develop herd immunity, and we would not be exposed, and he thought that was a better choice until we had more information. Pass on to a few years later, I was at the University of Pittsburgh living in Salk Hall, which was a former metropolitan hospital that had been converted to a dorm for the University of Pittsburgh. Allowed to go on the second floor of the building, but we're only allowed on the third and fourth floor. And I remember one time I was on an elevator and I noticed that there was someone that kept getting off on the second floor. And I said, why am I not allowed on the second floor? And what's on the second floor? And he said, my offices. And I said, who are you? And he said, I'm Dr. Jonas Salk. And so that's how I met Dr. Jonas Salk. So that's another little anecdote. And then years later, I met his brother while I was doing a residency in New York City. His brother was a pediatrician. So just a couple of little connections to the events around polio that come to mind. With that, hopefully you can copy me, and I will turn the transmission back to you, JAA4FL and 4TSC.
Andy, enjoy your dog sitting, and when the family returns, and enjoy the family. N4TSC, Jerry, are you back up and running? Go ahead.
Oh, I didn't know that I had dropped out, and I'm not sure what you had heard and what you didn't hear. So let me just turn it back to you and find out whether you heard anything in my previous transmission. AA4FL and 4TSC.
Well, last we heard, Jerry, was battery contacts being cleaned, solving a problem. You were about to give some anecdotal information about I don't remember if it was polio or monkeypox, but that's where we lost you. Go ahead.
Okay, AA4FL and 4TSC. Well, I was just giving some anecdotal reports about my connections with the polio vaccine. When I was 8 or 9 years old, I was the summer in Belmar, New Jersey, and we've done that every summer. And I remember that we were at a particular summer prohibited from going to Asbury Park, which was only 3 miles away, because of an outbreak of polio. And then I passed 2 years later when I was at the University of Pittsburgh, living in Salt Cole, which was a former city hospital building that had been converted to a dormitory for the university. And at that time, we were not permitted to go anywhere below the fifth floor. We were allowed only on the fifth floor and only allowed to go to vending machines on the third floor, I think. And one day I noticed that someone was getting off always on the second floor, and I asked, what's on the second floor? And he said, my office is. And I said, who are you? He said, I'm Jonas Salk. So that was my first connection with Dr. Jonas Salk. And then years later, I met his brother, who was a pediatrician at the hospital that I was doing a residency in New York City. So those are some of the connections that come back to mind when dealing with the polio vaccine. Also, the one other thing that I should report is that my internist at the time did not think it was a good idea that I become vaccinated against polio, because even though he said it's a killed virus, a killed vaccine, and therefore it was probably going to be safe, he thought it was a better idea to wait and let everyone else become immune, and that way we wouldn't get exposed. And until we had enough information, and he thought that the herd immunity was going to be equivalent, and that may be part of the resistance that people even have today against other vaccinations. A4FL and 4TS.
Well, thank you, Jerry, and for TSC, Jerry, preparing the ether here with information about polio in the next October issue. Would you mind typing up a little bit of a piece about you being in Pittsburgh and being in college and meeting Dr. Salk and also working with his brother later? And, what you remember of polio at the time. That would be a nice little counterbalance or in addition, added value to Warren's articles about polio and the past information from the ethers. But give something personal from a member perspective. I don't need it till the middle of September, but would you be willing to type something up and put it on it and put it in the email to me? Go ahead.
Don't know how much value it would have as an article because they're just anecdotal connections, but I can probably string something together and let you know. Just keep me reminded of it, and we'll try to put something out. Give me an indication of how much length you want and how evolved you want this thing, just as a simple statement or to piece it all together. A4FL and 4TS.
Well, thank you, Jerry. I think it'd just be more of an interest. The anecdotal is fine, just a little bit of your experiences and what you remember of being there at the time for our younger members that have really no knowledge of that, and the special interaction of being there. And anything you just said, I can always edit it down and take what would complement the material that's going to be in the edition. QSL, Jerry?
Sure, I can kind of do it like the man on the street interview that Steve Allen used to do. It's certain things that cross your path during your lifetime, and you don't know about what their value is until looking at it. So perhaps we can do something like that. A4FL and 4TS.
And for TSC AA4FL, a little bit of levity will go a long way. When I get comments about these, or the compliments I get are most often about Warren's approach, his jokes. People love his jokes and love his approach to journalism. So, yeah, mine are dry. Unfortunately, when I tell jokes, I certainly don't have the bite that Warren's do. Mine are. My father was a fourth grade teacher, so whatever jokes I tell seem to resonate with, third and fourth graders. So you guys definitely don't fit that mold. Are there any other discussions, guys? Any further discussion? If so, go ahead and make a call to AA for us. We'll take a list and start another round.
AA4FL and 5RTF.
And 5RTF. Good to have you back. Jeff, why don't you go ahead and take the mic?
Well, good morning, everyone. I'm in the French Quarter this week, so I'm using Yaesu System Fusion to get into the Pi-Star, and it's the least reliable of all three mechanisms. So that's why I'm cutting in and out. I had to stop and upgrade it and reboot it to make it work in 5RTF.
Well, Chip, thank you for letting us know, and no problem with the transmissions now. Did you have any input about the subject matter as you were listening? Go ahead.
Well, I've known several people that had polio as children. Probably the most prominent one was Arthur Guyton, who wrote the physiology textbook that most people in the world still use. He was my physiology professor and taught the classes himself, but he usually kept some crutches nearby and used those to ambulate. He also was the inventor of the electric wheelchair in 5RTF.
Okay, thank you for letting me know that, Jeff. It's a good thing polio was caused more morbidity and often in less severe forms, because it was mortality. Think of the people that wouldn't have made their inventions and their contributions to society. He was an educator and the inventor of the electric wheelchair. This is AA4FL, it's the Medical Amateur Radio Council Net, and we're going to bring the net to a close here shortly. Just one more opportunity if anybody'd like further discussion or start a new thread. If so, make your call to AA4FL.
N3IM.
UA2 BBQ for a brief comment.
Okay, thank you. Two of you with brief comments. Now let's start with Keith, N3IM.
Hey, 4FL in the group. This is N3AM. First of all, Jerry's transmission, I heard the whole thing the first time he gave it, so I'm not sure whether that dropout was on your end, Jay. But, and as far as Chip's concerned, I use a Pi-Star with YSF to DMR rather than the Fusion repeater in our local neighborhood. So, that's probably why I tend not to drop out so often. Also, just an aside, quick one. My father did his master's degree under Jonas Salk at the University of Pittsburgh, and then went to teach at Winthrop's College. I went to Women's College in South Carolina before going to medical school at Hahnemann. And I remember the days of the iron lung. I remember seeing people on the iron lung. And also I remember a young man in high school who had braces, the metal braces on because he'd had polio as a young man. This is M3IM. Back to the net.
Thank you for that additional information. I'd like to hear now from PY2BPQ. Go ahead.
Okay, for FL, PY2BBQ returning. Very, very interesting to hear about the Salk vaccine development by Gerard and also by Keith. And I need to correct something I said. I did a mistake with the polio saving vaccine and the smallpox vaccine. The virus orally given in the saving vaccine is the polio virus attenuated, not the vaccinia virus. This is for a smallpox vaccine, but uh, the rationale is the same as it is an enterovirus that is orally given, attenuated. It can spread to other children that did not receive the vaccine. As soon as you give to most of the children at the same time, you will produce like a vaccine epidemic with the attenuated polio virus given with only 2 drops orally with the saving vaccine. So that's the point. That's what needs to be emphasized in those vaccination campaigns against poliomyelitis. So that's the story. Very nice meeting today, and want to be here next week for talk to you guys again. So back to you, Jay, A4FL PY2BBQ.
Thank you for clarifying, Hilton. Do appreciate that. WJD, and you made an entry here on the NetLogger IM about being at University of Cincinnati where the work was done on the oral polio vaccine. Andy, why don't you tell us a little bit more about that? Go ahead.
Yeah, I don't have a lot of name dropping to go with that, but I did and there, and they did include that in our infectious disease curriculum and made a big deal out of it. You know, the University of Cincinnati College of Medicine was very involved with that vaccine. I remember when that was given. Of course, I received it in an armory, in other words, where the Army Reserve had headquarters in Portsmouth, Ohio. And there were adults and children, all alike, and lines are all the way down. Gosh, everybody got it pretty much. Everybody was, would almost knock everybody down just to make sure they got it. So, how times have changed. That's you, Jay, from WJP.
Well, thank you for the additional explanation there, Andy. I look forward to hearing more about polio, but hopefully that's just from a scientific basis and not from a disease spreading basis. Well, included in the ether, and only because of its timeliness. But again, hopefully we're not dealing with a situation of increasing morbidity. So time will tell, but we still got another 4 weeks before we do the ether. Jerry, if you can get that information to me even earlier, that we had talked about, that would be wonderful. Again, I'm going to start formulating the ether fairly early in September, so I can have it ready by the end of September. But we've got a lot of archives that we want to try to scan early in the month and make that available. And part of the ether will also be talking about the archives that are available for members to use. So Mike Lean and I are going to be doing that. So Prescott, Michael Lean Prescott, is the historian, and I'm going to help, and she'll start taking over writing the columns about 25 years and 50 years, 10 years and 25 years ago in Marco. So she'll start those columns. Now that and we just talked about it, actually, we could do 50 years ago, but I don't think we have any information that details. I don't think we have the newsletters back then, but I'll look and be sure as I go through the archives. I noticed ARL QST is now doing 100 years ago, in addition to the 50 and 25 and 10 that they always did. Is there any other discussion threads before I call the net to a close? Any other comments? This is AA4FL.
N3IM.
Go ahead, Keith. N3AM. This is AA4FL.
Yeah, speaking about the ARRL, are we going to be putting our ad back into their publication or not?
Yeah, we haven't spoken about that in a while. This is AA4FL. I suppose we could, but if we did, we'd probably want to integrate it into our website, so it's more of an ad interested in health and amateur radio, healthcare and amateur radio. And then boom. We'll probably use one of our new domains like healthcareham.org and let it redirect to our website. We could devise a strategy for that. We should have a Zoom meeting, board meeting soon. That could be one of the agenda items you can bring up, Keith. Over.
AA4FL N3IM. Yeah, okay. Sounds good. I just wondered because we didn't continue it there for a while, and I thought that was the original way that I personally found out about Marco. So I think it does have its advantages. This is N3IM.
Thank you for refreshing my memory on that subject because it has been asked before, Keith. Thank you. Well, this is AA4FL going to bring the net to a close for today. I'm not going to hang around after the net closes. I've got company coming myself and have a few honeydew lists, so the house will be properly set up and configured for some outdoor fun for the company. 7-3, all have a wonderful week, and I'll talk to you now next Saturday. Actually, I try to think if I'm available. Yes, I believe I am, but if not, I'll ask for net control. So let me say 7-3 to all, and we'll talk to you all in a week. This is AA4FL calling the net to a close after just making sure to show our appreciation here for the people at Quadnet Array who volunteer to keep the technology up and running and allow us the time to have the transcoding that we need for our net, for our members that have all different digital modalities. 7-3, calling the net to a close for the week. This is AA4FL.